All right, let's dive right in. What we're looking at here is essentially a strategic briefing on the world of biodefense. And this isn't just about what's happening in the lab with test tubes and microscopes. It's about this incredibly complex web of government policy, high-stakes funding, and the absolute cutting-edge research that really defines our ability to fight biological threats. And we're going to kick things off with a statement that, on the surface, might sound completely backward. How could ending a weapons program possibly hurt our ability to develop defenses? Well, this counterintuitive idea is actually central to understanding the massive challenges that immunologists and bioengineers are up against every single day. So this really gets to the heart of what we're talking about. Big decisions made in government buildings, often decades ago, have a direct and really powerful impact on the work being done under a microscope today. It's a surprisingly straight line from a policy memo to the day-to-day reality of lab research, and we're going to trace that line. So first up, we're going to explore how a celebrated act of international diplomacy actually created this huge unintended knowledge gap, a blind spot that has complicated U.S. biodefense ever since. Let's start with a little history. For about 27 years, the U.S. had a formal offensive bioweapons program. Now, this wasn't just about building weapons. It created a scientific baseline, a kind of high watermark for what a super sophisticated state-level threat could look like. Then, in '69, Nixon ends it. And by 1972, we have the Biological Weapons Convention. A huge win for diplomacy, for sure, but it came with a serious hidden scientific cost. To really get what that cost was, you have to understand the difference between a standard pathogen you'd find in a lab and a true weaponized agent. A standard strain, that's one thing. But a weaponized agent, that's totally different. It's been engineered for robustness, for aerosol delivery, and designed to survive and overwhelm an immune system. This is what's known as the maximum threat envelope, the absolute worst-case scenario that any defense has to be built to stop. And here's the kicker. When the offensive program was shut down, the U.S. essentially shattered the blueprint for that maximum threat. It lost its most critical stress test. So the challenge for modern researchers, and it's a huge one, is that they're now forced to try and rebuild this picture of a threat they're not even allowed to fully see. Okay, let's shift gears and see how this plays out in the real world. This is a case study from the 1990s that shows exactly what happens when that knowledge gap crashes head-on into a catastrophic failure of government oversight. Picture this, it's the early 1990s. The Soviet Union collapses. All of a sudden, you have thousands of highly skilled bioweapons scientists out of a job, and vast stockpiles of deadly materials are unsecured. It's a nightmare scenario. The U.S. response was the Cooperative Threat Reduction Program, a really noble idea to redirect these scientists toward peaceful research, but there was a massive hidden flaw in the plan. And here's the Trojan horse in this story, a network called BioPreparat. This wasn't just a couple of labs. This was the secret engine of the entire Soviet bioweapons program, and it was operating under the perfect cover of a civilian public health network. So when U.S. nonproliferation money started flowing, BioPreparat just put on its civilian hat and positioned itself to catch it. So how did this actually work? Let's follow the money. The allegation is that funds from, of all places, NASA, money meant for peaceful research like studying microbes in space, were secretly diverted. We're talking at least 10% of several grants, according to reports, were just siphoned off. So you have money for space research being used to prop up the very bioweapons program the U.S. was trying to dismantle. Just an incredible disconnect. And look, this wasn't just one mistake. It was a total systemic breakdown. Officials at USAID later admitted they simply didn't know about BioPreparat's classified history. They failed to check with national security. And on top of that, the official ban on helping biopreparats, it wasn't meticulously enforced. It was a failure at every level. Okay, so that's the history. How does this all connect to what's happening today? Well, this brings us to the high-stakes reality of the modern era, and to this idea of the dual-use tightrope that so many scientists have to walk every single day. First things first, let's get on the same page with this term dual use. This isn't some abstract policy idea. It's the unavoidable reality where public health and biodefense overlap. Every breakthrough in vaccine tech or gene sequencing that's meant for good, well, it could potentially be used as a blueprint for a weapon. That's the world we're in. And this leads us straight into this massive paradox. It's a real catch-22. To build truly effective defenses, we're talking vaccines, detectors, treatments, you have to first understand and sometimes even simulate the highest possible threat. And that means defensive research can end up looking remarkably similar to offensive work. It's a very, very fine line to walk. And you can bet this paradox sparks some really intense legal and policy debates. Like, does testing a fully working weapon system, even if it's for defense, violate the Biological Weapons Convention? Argument one says yes. If it works, it's a weapon. End of story. But the other side argues it's an operational necessity. How can you test your defenses without a realistic simulation of an attack? That's the gray area researchers have to live in. And just when you think that tightrope couldn't get any thinner, it does. The focus now isn't just on known threats like anthrax. It's about countering threats designed with modern tools like CRISPR. The new frontier is all about mitigating threats at the genetic level. And the key technical hurdle? Delivery. How can an adversary efficiently get engineered genetic material to a large population? So for our final section, let's pull all of these different threads together. We're going to connect the dots between the historical failures, the intense policy debates, and this boundary-pushing technology to really expose the core conflict at the heart of all this work. So when you take these systemic failures, like the BioPreparat situation, and you tangle them up with the intense debate over what's allowed and what's not, and then you add in these incredibly powerful new technologies, you get this: a core, unavoidable tension. History, policy, and technology all get knotted together. And what you find at the center of that knot is this fundamental conflict. On one side, you have the demands of national defense. That means necessary secrecy, strategic calculations, and simulating threats behind closed doors. And on the other side, you have the core principles of science: transparency, international collaboration, open data. The modern researcher is stuck working right in that overlap zone. So we end with a crucial question that policymakers and scientists have to ask themselves every single day. Does this work provide a clear defensive advantage that can't be easily misinterpreted as crossing the line into offensive development? Your knowledge saves lives, but it also represents a potential blueprint for some really sophisticated threats. That is the tightrope you walk.